This video was prepared as part of the course requirements of Human Anatomy at Saddleback College. The maxilla or maxillary bones are the upper jaw bones. They are partially involved in the formation of the floor of the orbits, the nose, and the palate. The maxilla hold the upper teeth, which perform an important function for mastication and communication. The median palatine suture is located in the midline of the hard palate between the palatine bones. The infraorbital foramen is a hole where the infraorbital nerve enters the face. The infraorbital nerve passes through the inferior orbital fissure and supplies sensation to the skin of the upper lip, lower eyelid, the side of the nose, and the cheek. The borders of the inferior orbital fissure in the lower part of the orbit are formed by the maxilla, the zygomatic bone, the sphenoid bone, and the palatine bone. The inferior orbital fissure is a pathway for several vessels and nerves, including the cranial nerve 5, the zygomatic nerve, and the infraorbital nerve. The maxilla, as well as the mandible, has an alveolar process for each tooth, where the teeth are found in sockets called alveoli. The alveolar margin is the bony ridge of the maxilla that holds the alveoli of the teeth. The maxilla and its rough projection, called the zygomatic process, articulates laterally with the zygomatic bones, forming the zygomatic arches. These are known as the cheekbones. The palatine process stands medially from the alveolar margin and forms the anterior portion of the hard palate, and together with the palatine bones form the roof of the mouth. The palatine process also forms part of the nasal cavity and helps to form the floor of the eye orbits. The maxillary sinuses are the largest of the paranasal sinuses that also include the frontal, desmoidal, and the sphenoidal sinuses. These sinuses are hollow spaces that help to decrease the weight of the skull and to produce a mucus that moisturizes and protects the inside part of the nose. The maxillary sinus lies from the floor of the orbits down to the roots of the upper teeth. The incisive fossa is a depression in the hard palate just behind the incisors. Inside this fossa is the incisive foramen, an oval-shaped opening between the union of the palatine process that form the intermaxillary suture. The incisive foramen is a pathway for blood vessels and nerves. The maxillary bones are known as the keystone bones of the face because they articulate with other important facial bones, including the nasal, zygomatic, ethmoid, palatine, and frontal bones, except the mandible. Hence, the maxillary bones are considered a central part of the facial structure. The maxilla foramina serve as a pathway for blood vessels and nerves that provide nutrients and sensory information to different areas of the face.